Invasive lobular carcinoma presentation by Karen Montaño. What is invasive lobular carcinoma, or ILC? ILC is the second most common breast cancer after invasive ductal carcinoma. As shown in the image to your left, ILC starts in lobules invading surrounding milk glands and breast tissue. The green portion would be the tumor cells growing outside of the lobules into surrounding breast tissues. Unlike invasive ductal carcinoma, which invades the ducts first, as seen in the image to the right. From a molecular standpoint, ILC is known to be more commonly estrogen receptor positive and HER2 negative. In invasive carcinomas, usually the cancer has spread or metastasized to other body parts. It's present in women over 60 years of age and is 10% of all breast cancers. This cancer tends to be in various places of the breast. Most of the time, ILC does not form lumps and is difficult to feel in breast. Here are a couple of signs to be aware of though. Hard thickening of breast, change in size of breast, lumps, hardening known in breast or underarm, dimpling, dent, or puckering of the skin on breast, nipple changes either inverted or pulling to one side, and a new pain that won't go away in one spot. Other changes to consider would be warmness, redness, sores, skin changes, as well as nipple discharge. Like I said before, most cases of ILC, there may not be any physical signs, and usually ILC is found after your mammogram. Invasive lobular carcinoma on a mammogram shows up with articular distortion like speculations, ill-defined masses, as well as densities. As you can see on these images on top, the densities of this mass are somewhat star-shaped and irregular, as shown by the arrows. The masses on the left show a mammogram with a rod to identify a scar, but below that you can see how irregular the mass is as well as the size of it. This image also gives us a preview in image C of an ultrasound image of ILC and how it would look compared to the MLO and CC mammogram images. Diagnostics and follow-ups. There are various other forms of diagnosing this cancer besides a mammogram. Ultrasound can be used by itself or used for the assistance of a needle biopsy, as demonstrated in the image here to your right. There are two types of needle aspirations that are done. In fine needle aspiration biopsy, there is a very small hollow needle that is inserted in the breast to retrieve a sample of cells to be examined microscopically, which leaves no scars. In core needle biopsy, a larger needle is inserted to remove several cylindrical shaped samples of tissue from the mass. With this method, a tiny incision is made in the breast, leaving a tiny scar that will become barely visible. MRI is also used to gather more information about a suspicious growth in the breast. As seen in the bottom left image, the patient is lying face down, exposing the breast for imaging. Normally, MRI has found contralateral breast cancer that was not found previously. These extra imaging techniques usually help corroborate the pathology findings in the breast mass or suspicious growth found in the mammogram. For any patients that will be having a follow-up after any of these procedures may require various different follow-ups depending on the stage of their mass. Usually, patients are required to have a consistent checkups for the following 4 to 5 months over a time span of 5 years. It is very important that you find support with coping with a follow-up after any of these procedures. It can be a scary thing to find a mass and have to come back for more imaging later. Here are a couple of images that show different imaging techniques used for finding masses. Top two images show a CT scan of the breast with ILC demonstrated with the arrows. As you can see on the image to your right, the tumor has spread to the chest wall. The right images demonstrate ultrasound-guided image biopsy with a mass next to it. As you can see, there is a needle in this image B showing us how it is done. And you can see how there's the needle in the ultrasound right next to the mass. The bottom image is of a microscopic image of cells that have been biopsied and seen under a microscope. These tumor cells show solid alveolar and glandular units forming together. This arrangement is called an Indian file due to its linear strands. Staging the cancer. When staging any type of breast cancer, there are three things to consider. Localization, the size of tumor, whether or not it has grown into nearby areas. Region, if the cancer has spread to nearby lymph nodes. Distance, if the cancer has spread to other parts of the body. There are subcategories for breast cancers to help to receive more appropriate treatments. With the subcategories, they look to see if the cancer is found in the axillary lymph nodes. Depending on how many lymph nodes are affected will depend on what stage. If there is HER2 positive or negative, if estrogen receptor positive or negative, and if progesterone receptors are positive or negative. Stage 0 has no spread of tumor. Stage 1, tumor is localized and small. It has a subcategory of 1A and 1B, which both distinguish invasive cancer but in different locations of the breast and different metric sizing the tumors. In these subcategories, they do not look for any hormones. Stage 2 would be an increase in size of tumor and invading lymph nodes. Subcategory 2A and 2B taking into consideration hormones being present. Stage 3, these tumors are large and are growing into nearby tissues, or they have spread to many nearby lymph nodes. Subcategories 3A has a grade 2 and subcategory 3B has a grade 3. And all hormones are positive except for subcategory 3C, which is a grade 2. Stage 4, the tumors have spread beyond the breast and nearby lymph nodes to other parts of the body, becoming metastasized. Treatment options. Depending on the stage of your cancer, you have normally your cancer isn't too metastasized. You do not have to take you do not have to have a mastectomy. Usually, if your cancer has invaded a larger tissue area, a mastectomy will remove all the breast tissue to prevent the spread of recurring tumor formations. These are just some of treatment options that can be recommended by a doctor depending on what specific stage the patient may be in. Radiation therapy helps kill the cancer cells. Lumpectomy as well can help for the spread of cancers. Metastasis. Many times the cancer starts in the breast, then spreads not only to surrounding tissue but other body parts as seen in the images. This would be a more severe case of ILC. In the right image, it is showing a PET scan of a patient with ILC that has spread to her bones. In the image to the left, it shows where the primary tumor has formed and common areas where it normally metastasized. The red arrows show enriched metastatic sites where normally they wouldn't be. Survival rate. Tracked in a time span of 5 years, and normally the rate of surviving this disease decreases as the stage becomes more severe, as this chart is showing us. Higher chances of survival in these stages and a lower chance of survival in stages 3 and 4 due to the metastasis of the cancer in various body parts. So if you have stage 0, you have a higher chance of survival than if you have stage 4 breast cancer. And this is my works cited list, and that is all for my presentation. Thank you.